Okay, 5 minutes on this statement, which is really well written, and you'd be surprised what's actually in this one. The links, I think, make it a really useful mind map. Instead of going to the websites, let's look at the primary care management first and our role in managing primary contact, working in partnership, coordinating and referring care, promoting sexual health and strategies for early detection of sexual health problems. The symptoms are pretty much the ability to take an appropriate history and to pull out and manage these symptoms. And we'll look in a minute how you can use the map to fulfill these needs. The common and important conditions are listed here and include things such as ulceration, HIV, neonatal conjunctivitis, sexual dysfunction, and so on. This primary care management section also contains investigations, treatment and management, emergency care, and prevention. So dragging the map to the center, right click, put show level 1. It'll then bring the map into contrast. Look at the websites next, the usual generic ones, as well as specific ones on sexual health. Click there, go down to here, and it'll say focus on selected topic and open it up. Drag this across to make it a little bigger so that you can read it at a comfortable level. I'm just going to again click and drag this up here. STIs. Right, we already know what areas we need to cover, and this is a really useful link to Patient UK and sexually transmitted disease. If you did nothing but read this particular article and follow its links, you'd be well on the way to covering a lot of the STI aspects of this statement. Though remember, it also covers smears and indeed contraception, which you might think would appear in the women's health or men's health sections of the curriculum. So what's in here? So this is an overview of STDs, including its epidemiology and the recent figures on all these different conditions, as you'd expect, risk factors, but then links into the individual conditions. And though these are geared specifically to patients, I think they're enormously useful for doctors as well. You can always fill in the details by going to more specific resources if needed. Moves on to sexual history, taking an examination, and then what to do if the patient is asymptomatic or symptomatic, and so on. And down here we have links to references. These range from the British Association of Sexual Health to the clinical knowledge summaries, all of which are links in the map as well. This next site is really great. Women's Health in Brighton and Sussex has some great protocols. You can look at individual areas, and this is actually in real time. For example, this choice of combined pill is one I often use. What are the progestogenic, what are the estrogenic side effects, and which pills are progestogen and estrogen dominant? The Sexual Dysfunction Association has some great leaflets. Just click on advice and go to the one you're looking for. These are leaflets that may not be available on Patient UK, for example, so I find it useful. Terence Higgins Trust, Marie Stopes. Here again, you might think of this more as a women's services website, but if you go to men's services and click down to aftercare video for vasectomy.
Some men feel fit enough to go back to work the following day, while others may need longer to recover. You must also avoid heavy lifting and vigorous exercise for at least a week after your procedure.
That gives a sort of practical information which GPs and patients need. STIs in primary care is a link to this excellent document from the RCGP and BASH. And Bandolier, as always, is good for mainstream stuff, as well as perhaps slightly non-mainstream stuff. Sperm counts in the West are falling, is that true? Moving on quickly, in the rationale it mentions that this statement also covers contraception and cervical screening. And don't forget that sexual health can interrelate with mental health, drug misuse and alcohol misuse. Clicking on UK Health Priority and pulling the window across will reveal that teenage pregnancy is another very important aspect of this statement. And in England, you can see that the strategies are as follows. To keep this video short, I'm going to end soon, but you get the principle. In primary care management under prevention, there's the national screening programs, and I would recommend this link to anyone who has many foreign patients on their books. Attitudinal aspects contains links on consent, Gillick-Fraser confidentiality, and so on. This is a link to best practice guidance in under 16s, and under scientific aspects, national guidelines to the DOH's site on sexual health and HIV, including national screening for chlamydia. I hope that was useful. Thanks for listening.